BEL-3 evaluated PI3 kinase inhibition in hormone receptor positive breast cancers that were resistant to both endocrine therapy and mTOR inhibition. So the rationale is that this pathway is very important in endocrine resistant breast cancer, and it also appears to play a role in resistance to mTOR inhibition. So the design of the trial was postmenopausal women with hormone receptor positive metastatic breast cancer who've been treated both with aromatase inhibitors and mTOR inhibitors prior to entering the study. They were randomized 2-to-1 to receive bupartisib, which is a pan-PI3 kinase inhibitor, with fulvestrant or fulvestrant plus placebo, with endpoints of progression-free survival and then secondary endpoints of overall survival, and also outcome based on PIK3CA status of the tumour and in liquid biopsies. So the trial met its primary endpoint. Progression-free survival was significantly improved in patients who got bupartisib plus fulvestrant compared to fulvestrant. The difference was about 2 months, but it was statistically significant. The other endpoints, response rate, clinical benefit rate, were also improved with bupartisib. So looking at some of the secondary endpoints, PIK3CA mutation analysis was done on both on primary tumour using PCR and also in ctDNA using a beaming technology. And about a third of patients in the study were noted to have PIK3CA mutated cancers. In that group of patients, the bupartisib arm was better than the control arm in terms of progression-free survival. In the patients who had wild-type cancers on the primary tumour by PCR, there was no difference between the two arms, but in the patients who had wild-type tumours based on the ctDNA, there was still a signal that the bupartisib arm was better than the control arm. The other group that kind of panned out as doing better with bupartisib were patients with visceral metastasis. So those patients did better in the study arm. In patients who did not have visceral metastasis, there was no difference between the two arms of the study. As far as safety, there was really no new safety signals. There were more adverse events, more dose interruptions and reductions on the bupartisib arm compared to the control arm. They were mainly elevations in transaminases and the psychiatric issues that have been described previously with this drug. So really no new adverse events noted.